Providing medications for opioid use disorder has been one of the most rewarding parts of my career. And I think the reason for that is more than almost any other treatment or intervention that I can think of, the impact that you can have with medications for opioid use disorder on somebody's life. I have never met a pregnant or parenting person who did not want the best for their child. And that motivation is so incredibly powerful that it really gives us some of the most amazing outcomes that we get to see when we're treating opioid use disorder. I think that there is a really strong misconception among providers that folks don't want to get better. I really challenge that. I think so many times when you talk to people and you say, like, don't you want this? The answer is yes. They want to live a normal life. They want to be with their children. They want to hold down a job that is meaningful to them, right? It's that getting out of this hole that they are in is really hard, and we need to support them in whatever way we can. We need to bring down those barriers to treatment. And that means making MOUD as ubiquitous and as widely available as we possibly can. My dad was an amazing guy. He was a fantastic father. He was an anesthesiologist, incredibly brilliant, very patient-centered, kind, and he also had an opioid use disorder. And so I lost my dad to an overdose when I was 20 years old. Unfortunately, my dad never was offered the help that he needed, and I very much believe that's why we lost him. And I do wonder often whether if he had gotten medications for opioid use disorder, if anybody had talked to him about that, whether he would have had the chance to meet his grandkids or walk me down the aisle. Addiction is a family condition. It's a family illness, right? And so when you treat somebody who has opioid use disorder, you're not just treating that person. You're treating their kids, you're treating their loved ones, and you're saving them and really the whole community the loss of that person. When you get to work with this population and give them options and tools that help them to achieve their goals, you really can have such an amazing impact, not just on that person that you're working with, but on their children, on their family, and on their community.